Mucosal lichen planus. The mucosa may be involved in 30 to 70% of individuals with cutaneous lichen planus, and it can be the sole manifestation in many. Any mucosal surface may be involved, the buccal mucosa, anus, conjunctiva, but the posterior buccal mucosa is the commonest site of involvement. Tongue, gingiva, palate, lips, and floor of mouth may also be affected. The different clinical subtypes that can be seen in the oral mucosa are the reticular pattern, erosive, atrophic, and the plaque type of lichen planus. Most commonest type of oral lichen planus is the reticular type, in which the patient is relatively asymptomatic. In the erosive type of lichen planus, the patients experience pain and discomfort while consumption of spicy food. In this subtype, there is a small chance of developing squamous cell carcinoma. Here you can see the lazy network on the buccal mucosa of a patient. That is the reticulate type of oral lichen planus. Another patient with the white network along with the violaceous hue on the lower lip. A violaceous plaque on either sides of the tongue, that is the lichen planus of the tongue. Violaceous pigmentation, and if you notice closely, you may also experience the white network on the inner portion of the lower lip. Now, nail changes in lichen planus are not very common, though it can be seen in around 10 to 16% of individuals. Many non-specific changes can be found on the nail plate, like ridging, grooving, and splitting. But the most classic change in lichen planus is the pterygium of the nail, where the proximal nail fold gets attached to a defect in the nail plate to form a wing. This is a permanent damage. This is a picture of a patient with pterygium. If you notice carefully, you can see the proximal nail fold which is attached to a defect in the nail plate. Now, lichen planus has an unpredictable course. It usually resolves within around 18 months with hyperpigmentation, but around 15 to 20% of individuals with lichen planus, mainly the eruptive lichen planus, experience relapses. The hypertrophic lichen planus, the oral lichen planus, and the lichen planopilaris may be persistent for many years. Malignant changes can be noted in erosive lichen planus and also in hypertrophic lichen planus.